Was your labor induced? If you are currently pregnant, is there talk of inducing your labor? What is induction of labor? Labor induction is when uterine contractions are stimulated to hopefully result in a vaginal birth. There are numerous reasons induction of labor may occur. Maternal indications like gestational diabetes or hypertensive disorders, fetal indications like IUGR or intrauterine growth restriction, oligohydramnios or low fluid around the baby, social indications like living a great distance from the hospital or having a history of sudden labor and delivery. We call that precipitous. ACOG, or the American College of OBGYN, has historically taken a more hands-off approach where inductions are concerned, and that they don't recommend induction of labor unless it's medically indicated. Cervix favorability. That has to do with its dilation, consistency, position, effacement, and baby's station in the pelvis. Taking all of these measures into account, a Bishop score is assigned. The Bishop score is a scoring system that determines the readiness of a cervix for labor. Based on the aforementioned components, i.e. dilation, consistency, position, effacement, and station, a composite score of 0 to 13 is given. Anything less than 6 is deemed unfavorable, i.e. the induction isn't likely to result in a vaginal delivery. When the cervix is not favorable, cervical ripening may be proposed. This can either be achieved mechanically or medically. Mechanical cervical ripening involves inserting a Foley bulb or Cook's balloon into the cervix. Either is inflated with sterile saline or water. This puts the cervix under pressure, causing the cervix to release chemicals called prostaglandins. These prostaglandins in turn cause the cervix to soften, become more effaced or thinned out, even sometimes more dilated. Medical induction involves the use of certain medications that contain those previously mentioned prostaglandins. These medicines can be taken orally or placed inside the vagina to cause the cervix to soften or thin out, and thus become more favorable for induction. So when the cervix is favorable, oxytocin, a chemical given to cause uterine contractions, is given through an IV. Uterine contractions will usually begin within 30 minutes of starting oxytocin. Oxytocin can be given either to induce or augment, i.e. speed up, a labor that has already begun. And if your water doesn't break spontaneously, something called an amniotomy may be performed at some point during your labor induction. This is typically done by your OB by using a special instrument to put a small hole in your amniotic sac. That's the sac that baby swims around inside of your uterus. Once this is done, your contractions are likely to become more intense and sometimes more frequent. If you are considering an induction, or it is something that has been suggested to you by your OBGYN, have a frank discussion regarding the indication, the pros and cons, and whether this is something that is right for you. If the induction is for a medical indication or due to fetal indications, the conversation is not so much whether it is right for you, as medical or fetal indications are a clear reason for the induction, but rather what the process of your induction will look like. I hope this helps. Check out the blog post on induction as well as the podcast for more information. Thank you.